how to get pregnant faster with one fallopian tube, how you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation? You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today. I welcome you to this channel. On this channel we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerald Massa, the Health Educator, is the name of the channel, and I welcome you, my friend. Stay with me, watch this video to the end. We are going to talk about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a very simple recipe. It has worked, it is working for many couples. It will work for you to watch this video to the end, and we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a simple recipe. So what is happening is that we shall begin by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember you can easily get pregnant very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses. And then when you begin counting from the first day when you saw your menses, then there's going to be the 14th day. That is when you are actually going to be ovulating. So if you are a woman out there and you have a regular cycle, and even if your cycle is irregular, still you just have to pick out a particular month which is really okay, which has been consistent, and then you basically have to count from the first day when you saw your menses, count up to the 14th day. When we talk about your cycle or your menstrual cycle being regular, specifically we are talking about knowing that the menstrual cycle is divided into two phases. We have the follicular phase, and then we do also have the luteal phase. So when you have your periods on day 1, then you see your periods on day 2 and then day 3, what you need to do is basically count from the first day you saw your periods, that is day 1, and then count up to the 14th day. And on the 14th day, that is when you are going to be ovulating. That is when you are most likely to be ovulating. So what happens is that the 3 days leading to ovulation, during the 3 days leading to ovulation, there's a release of a hormone. This hormone is known as luteinizing hormone, also abbreviated as LH. This hormone stimulates the whole process of rupture. So what is happening is that when you see your menses on day 1, then there's going to be a release of a hormone known as luteinizing hormone, and this hormone is specifically responsible for the rupture of a mature Graafian follicle. A mature Graafian follicle is basically a mature egg. So when we take a look at this diagram, you realize that the whole of this is what we call the reproductive system. This is the reproductive system of a woman. It has actually several parts, but we shall talk about them in a nutshell. We have one ovary this side and then another ovary, and then we do also have the fallopian tubes, and then we do also have the fallopian tubes attached around here, and also these ligaments which support the ovaries. So the whole of this is basically layers of tissue. It's known as the myometrium, and then the outer thin layer is what we call the perimetrium or the epimetrium, and then we have the inner layer which is known as the endometrium. What happens is that when an egg has been released, it's going to grow. When a woman has just seen her menses, when a woman has just seen her menstrual cycle, or when a woman has just seen her periods, there's going to be growth of these eggs from a very small size, and then it goes on growing until it matures. So the first stages when the egg is growing, basically this is known as, the first stages when the egg has just started growing, it is known as the follicular phase. Follicular comes from the word follicle, whereby there's growth of a small egg. It goes on growing until it matures into a ripe egg known as the Graafian follicle. The whole process of maturation, the whole process of growth of this egg until it reaches this point of being very mature, ready to be released, this whole process is supported and it is stimulated by a hormone known as luteinizing hormone, working together with another hormone also known as estrogen. But luteinizing hormone is the most important hormone here. It plays a very big role in helping the maturation and then the rupture of this mature egg. When this mature egg ruptures, this is what we call ovulation, and normally there will be semen released, and this semen can come in, the male sperms can come in, and then they can meet around here, and then fertilization can take. So thank you once again, my friend. We are proceeding with the whole process of ovulation, and we have said that when the egg has been released on the 14th day, basically this is what we call the day of ovulation, or the day when you are most likely to get pregnant. But still, the 3 to 4 days leading to ovulation, still you can get pregnant. Having talked about this, we are going to answer our question: is it possible for a woman to get pregnant when they have only one fallopian tube? The answer is yes. It is very possible. The most important thing you have to do is you need to understand your ovulation calendar, and then also you need to understand that when the fallopian tube is not blocked and the fallopian tube does not have any issues with maybe fluid inside it, then there are high chances that you can easily get pregnant. What you need to do, or what you need to know, is that the fallopian tubes should be patent, or they should be open. It is very easy for a woman with a fallopian tube which is open to get pregnant, as long as the tubes are open, and then as long as this particular woman is actually ovulating very well. So when you are a woman and you ovulate very well and you have one fallopian tube which is not blocked, then you can easily get pregnant. Though in most cases there are times when your fallopian tubes may be blocked, still this has to be confirmed by your doctor, whereby an investigation will be done. This investigation is known as the HSG, or the hysterosalpingogram. It's an examination whereby your fallopian tubes will be analyzed under a special technique, and when the report comes out that your tube is blocked, unblocking can be done in hospital. So we are talking about how to get pregnant faster with one fallopian tube, and how to boost ovulation naturally with just a simple recipe. And we have said that during the process of ovulation, as long as a woman is ovulating very well until the 14th day, she can always get pregnant faster naturally. And then the other most important thing is that you need to understand how your cycle runs. You need to understand that if you are a woman and you have a cycle that runs for 22 days, then the days you are ovulating are going to be between day 6 and day 10. And then if you are a woman and your cycle runs for 24 days, then the days of ovulation are on day 8 and day 12. All together until when you reach 45 days, still the days of ovulation are between the 26th and the 30th day. So having known all that about the menstrual cycle and then the calendar method, we are going to talk about one simple recipe that can help you get pregnant faster, and this is what we call citrus fruits. Citrus fruits are very, very important. It's actually very important because it contains lots of vitamin C, which is very important. It is very key in handling, and it acts as an antioxidant, and it basically works on free radicals in your body. But in fertility, in managing fertility cases, it actually boosts fertility because it contains a very important element. It contains a very important substance known as polyamine putrescine. Polyamine putrescine is very important because it has been known to boost egg quality, and then also it has been known to boost sperm quality. So if you are a woman, if you are a couple trying to get pregnant, make sure that you consume some citrus fruits because they do contain polyamine putrescine, and then also they do contain they actually contain vitamin C, but in this particular case the polyamine putrescine is very, very important because it boosts sperm quality, and then also it boosts egg quality. We have been talking about how to get pregnant faster with one fallopian tube, and we have said that you just have to make sure that the fallopian tube is not blocked, and then you should be ovulating very well. If you are not ovulating very well and the fallopian tube you have is actually blocked, then it may be a bit difficult to get pregnant faster. The other thing is that how to boost your ovulation basically faster. You basically have to go on and then take lots of citrus fruits because they do contain polyamine putrescine, and then also polyamine putrescine has been known to boost sperm quality and egg quality. According to a study which was done by Dr. Murphy, polyamine putrescine is known to boost sperm quality and egg quality. Gerald Massa, the Health Educator, is the name of the channel. I welcome you, my friend. I thank you for staying with me for this while, and I hope you have learned something in today's video. What you need to take home is that you should take lots of citrus fruits if you are a couple trying to get pregnant, and then the next thing is you should know that you can get pregnant easily even if you have one fallopian tube, as long as you are ovulating well, and then as long as your fallopian tube is open. You can connect with me on my WhatsApp numbers. They are just around the corner down here on the right side. You can connect with me in case you have any questions. Also remember, what is a baffling cyst? In this video today we are going to talk about the baffling cyst. Hello my friend, I welcome you to our channel, Gerald Massa, the Health Educator. On this channel we talk about the ovulation calendar, we do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. By the end of this video, you are going to know what a baffling cyst is, and what is a baffling cyst, and how best it can be treated. So without further ado, we shall define a baffling cyst, and we shall say that a baffling cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a Bartholin's cyst. So we are going to look at the symptoms of a Bartholin's cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk. And then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump, which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina, known as the labia majora, and specifically one side may be very, very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very, very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cysts? What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cowpeas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bartholin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bartholin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bartholin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bufferlin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video, we are talking about Bufferlin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bufferlin's glands, and the Bufferlin's glands are around the size of pea, that is PEA, cowpeas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bufferlin's cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bufferlin's cysts. So it is very, very important that when you have a Bufferlin's cyst, you should be able to get treatment, and the best way of preventing Bufferlin's cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. Gerald Massa, the Health Educator, is the name of the channel, and in this video today we have talked about the Bufferlin's cysts, and we have said that these are swellings which become of the Bufferlin's glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. To subscribe for new videos we release every day. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Hello, my friend. Welcome for today's lesson. This is Gerald Massa, the Health Educator. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss new videos we release every day. On this channel, Gerald Massa, the Health Educator, we talk about the ovulation calendar, we talk about the ovulation calculator, and we do also give pregnancy advice. Remember to subscribe so that you do not miss any videos we release. I welcome you, my friend, and watch up to the end because there's lots of information, lots of good tips for you today. Have yourself a good time watching this video. I welcome you, my friend. Thank you. Can you get pregnant when you are 40 years and above? In this video today, we are going to share the tips for you how you can get pregnant faster when you are at 40 years, and even if you are above 35 years. These are the tips for you. Have you tried to get pregnant and you are at 40 years and above? Then this video is for you. Gerald Massa, the Health Educator, is the name of the channel. If it's your first time on our channel, you are most welcome. Remember to subscribe so that you do not miss new videos we release every day after actually 17 hours. So we are talking about the tips to get pregnant faster when you are above 40 years. Without further ado, we shall begin with the first tip, and this is you need to improve your ovarian reserves. When we talk about improving your ovarian reserves, specifically, we are talking about what you need to do to improve your egg quality. To improve your ovarian reserves simply means you need to do things which will improve your egg quality. How can you improve your ovarian reserves? How can you improve your egg quality? You need to actually pay attention to what you eat, because lots of foods which are high in the hormone estrogen may actually affect your ovarian reserves. Then also, if you are having issues with your menses, then your ovarian reserves may be actually destabilized. So you need to make sure that if you would like to get pregnant and you are at 40 years, you are above 35 years, you need to work on your ovarian reserves. There are lots of supplements on the market. You need to talk to your pharmacist. They will prescribe you or they will advise you on the best supplements which can improve your egg quality. So if you would like to get pregnant faster and you are 40 years and above, or even you are above 35 years, you have tried to get pregnant for a period of 6 months, then improve your ovarian reserves. Next tip on how you can get pregnant faster when you are 35 years or even above 40 years, you need to look at your lifestyle habits. When we talk about your lifestyle, we are talking about things like exercises. If you are trying to get pregnant and you are at 45 years, you are at 40 years or even above 35 years, you need to work on your body. You need to actually reduce over exercising. If you have been exercising a lot, you need to cut down at least 2 to 3 days in a week. Exercises for 20 to 30 minutes will do. When you over exercise, there are high chances that there's going to be an effect on your hormones, and then your chances of getting pregnant may be affected. So the first tip was to improve ovarian reserves, and then the next tip is you need to work on your lifestyle habits. And then when we are talking about lifestyle habits, we shall not forget to talk about stress. Stress is that feeling you get when you are actually overly over anxious, or whenever you feel that you are in a state of anxiety, you are thinking a lot, you are always not at ease. There's going to be changes that will be happening to your body. There's going to be release of a hormone known as cortisol. Now, cortisol is a stress hormone, and it actually has an effect. It has a direct effect on your chances of getting pregnant. So, lifestyle habits includes managing stress, working on exercises, and then also monitoring key things in your life. Next tip for you to get pregnant faster when you are at 40 years or even when you are above 35 years, you need to actually do what we call routine medical care and checkup. You need to do routine medical care and checkup. When we are talking about routine medical care and routine medical care and checkup, we are advising that if you are above 35 years, if you are at 40 years, or you are approaching 40 years, and you have tried to get pregnant and things have not really worked out very well for you, you have failed to get pregnant, then you actually will need to do some medical procedures. You need to do some medical tests or investigations. And the commonest investigation we always talk about, what I always advise all our clients, is that you need to actually do what we call a pelvic ultrasound scan. You need to do a pelvic ultrasound scan in hospital. A pelvic ultrasound scan is specifically an investigation, or it's a test which is done in hospital, whereby pictures or images of your reproductive system will be taken. And when we talk about the reproductive system, specifically we are talking about the 2 ovaries, and then also the tubes, the fallopian tubes, and then the inside of your womb, also known as the endometrium, and then also your cervix, remembering that the cervix has two parts. It has the internal part, also known as the internal os, and then the external os. So you need to do tests to identify whether your ovaries are showing normal reserves or whether your ovaries have sufficient follicles. Your ovaries should be able to show dominant follicles. Dominant follicles are those eggs which are actually mature and they are ready to be fertilized on the 14th day. Then next, the ultrasound scan or the HSG scan, the hysterosalpingogram scan, will show whether your tubes are patent. It will show whether your tubes are open, because if you are at 40 years and your tubes are blocked already, then the chances of getting pregnant will actually be very, very low. So you need to make sure that your tubes are open and they are patent. They can transport a fertilized egg up to your womb. And then talking about the womb, your endometrium or the inner lining, this part around here, that is the inside of your womb, should actually be showing normal thickness. If at all the thickness is so big, or if at all inside your womb, inside your uterus, you are showing signs of free fluid, also known as endometritis, or if you have fibroids in your system. If you have fibroids in this part here, also known as the myometrium, then there are high chances that fibroids are going to make your chances of getting pregnant to be very low. And then also, if you have cysts, cysts are small fluid-filled swellings, or these are small swellings or masses which are in your uterus. So if you have these small swellings, then you actually will need to see your doctor, who will put you on treatment. And then, of course, if the cysts are treated, if the fibroids are treated, or if the endometritis is treated, then it means your chances of getting pregnant very fast will be actually increased, because at the end of the day, we need to make sure that the ovaries are also functioning very well. The the four things which tend to make chances of getting pregnant to be either high or low, they are actually four. The first one is that your ovaries should be functioning very well. When we talk about the ovaries, there's a hormone which brings about the functioning of the ovaries. This hormone is known as the follicle-stimulating hormone. So if you have issues with this hormone, then your chances of getting pregnant will be very, very low. The main reason is that this hormone is responsible for the maturation of your eggs. It is the hormone which will make your eggs to grow, to mature. So if your ovaries are very okay, if you are ovulating, you are 40 years or above 35 years, but you are ovulating very well, the inside of your uterus is okay. It is free from masses. It is free from fibroids. You do not have any free fluid collecting inside your womb. And then if your tubes are patent, if your tubes are open, then it means that you are actually at increased levels of getting pregnant. You have increased chances of getting pregnant. You do not need to stress yourself. All you need to do is to have your partner, your husband, do some simple tests. The first test is what we call the urine culture and sensitivity test, whereby a sample of urine of your husband will be taken, and then it will be analyzed in the lab for some changes, both macroscopic and biochemical changes. In simple terms, your urine will be analyzed for appearance. It should be colorless, and then the other thing is that it will be analyzed for presence of residues. If the urine sample actually has urine, if the urine container has your urine, but your urine is filled with residues, there are particles in the urine. Even you yourself, when you are taking the urine to your doctor, you look at the container and specifically you see white particles in your urine. Then you actually will begin getting a clue that there could be something happening. I'm not advising that you do the test yourself. You need to take the sample to your doctor or your laboratory technologist, who will do the analysis or who will do the test on your urine, whereby things like the pH or the acidity or the alkalinity of your urine will be made on the report. Normal is supposed to be 3.0 up to 6.5, and then this can vary from country to country. So in your country, you may be told that your normal pH of urine is 3 up to 6 or 3 up to 6.5. So specifically, this will be it will be your doctor to decide. I mean, it will be your doctor to decide according to how their reference ranges are and then according to what they've seen, because it's always advisable in the medical world to report what you've seen. So next is that your urine will be analyzed for presence of cells. These cells are called yeast cells. If you have yeast cells in your urine, and then it means it will give us a clue that there's something causing these yeast cells to be shed in your urine. And that's when we think of fungal infections. For example, the Candida albicans or the Candida vaginitis infection. So if you are a woman and you are at 40 years, you are looking at getting pregnant, you have tried to get pregnant, but things are not working out well, there are 4 key things. The first one is that it could be a problem with your ovaries. You could be having what we call ovulatory dysfunction. It could be a problem with your fallopian tubes. Your tubes may be blocked. They may be blocked with free fluid or your fallopian tubes. Your fallopian tubes may be blocked. The first one was you could be having ovary problem, or you could be having ovulatory dysfunction. Your ovaries may not be undergoing the whole process of ovulation very well. Or you could be having issues in your ovaries, issues like the POF, that is primary ovarian failure. Primary ovarian failure is a complication which is actually very serious. So next is it could be a problem with your tubes. Your tubes may be blocked with either free fluid, or your tubes could be blocked with, or it could be blocked by adhesions, and then also it could be blocked by things like cysts. So if you have issues in your ovaries, if you have issues in your fallopian tubes, then you may actually need to be treated at the hospital. And then next is you may be trying to get pregnant when you are 40 years or above 35 years and things are not working out. Probably when you have swellings in your womb, if you have disease of the reproductive system, like for example cysts or fibroids or endometritis, then you may actually need to have these checked out or treated, and then you'll be able to get pregnant. And then next tip for you to get pregnant, if you are above 35 years or if you are approaching 40 years, is that you need to understand ovulation. When we talk about ovulation, if it's your first time on our channel, we talk about ovulation a lot on this channel. So ovulation is the release of a mature egg on the 14th day, and specifically what happens is that when the egg has been released on the 14th day, it lasts for only 12 to 24 hours. If it's not fertilized, then it disintegrates around this part. And then, of course, when it disintegrates, then it means that the pregnancy has not yet formed. And then if it is fertilized, then it means there's going to be a release of hormones in your system. The first hormone is what we call progesterone, and then the next hormone is estrogen. These hormones are going to rise, and then they are going to increase the thickness of your womb, what we call endometrial thickness. It will increase, thereby preparing your womb for implantation, so that when the fertilized egg comes in, when the fertilized egg, that is the embryo or the blastocyst, comes in, and then it attaches itself on the womb, it will be able to stay on the womb for the next 40 weeks or for the next remaining 8 months. So these hormones play a very big or a very important role. If you have issues with your hormones, if your hormones are not balanced, if you have low progesterone, then it means that as soon as the fertilized egg comes in and it attaches itself onto your uterine wall, then it's not going to be there for a long time. It's going to be shed out, what we call a chemical pregnancy or a very early pregnancy loss. So if you are a woman and you have been having recurrent miscarriages, every pregnancy you gets out, or you undergo miscarriage, this is on a serious note. It's really not a good thing. So you need to be checked out for progesterone. You should do what we call progesterone tests, and then also you need to do a pelvic ultrasound scan, and then also your cervix. Remember, we talked about the cervix around here. We said that it has two parts. It has the internal part and then the external part with an intracavitary pouch around here, sort of like a small rounded structure. So if your cervix has issues, if your cervix is not competent, what we call an incompetent cervix, then you may actually need to undergo treatment. Your doctor or your gynecologist will do treatments like the cervical sacrilege, whereby your cervix will be strengthened by a small thread that is in the theater, but still you can go ahead and get pregnant. One word you need to take from this video is that you can get pregnant. The key is you need to understand what is causing your issues. You need to understand what is preventing you from getting pregnant. Because whatever happens, where there's a problem, there's a solution. Whenever there's a problem, there's a solution, but you need to get the solution from the experts. And that's why I'm requesting that if at all you have any questions, just below this video, comment your questions and I will answer all your questions personally. I'm really so happy to answer all your questions. If at all you would like to have a private chat with me, you can connect with me on my website, www.geraldmassa.thehealtheducator.com. It's just below this video. You can connect with me, ask me, have a private chat with me. You never know, you might have tried everything, but I can talk to you, we can talk, and you just never know, you may get that one key which you are actually lacking to unlock, all your chances of getting pregnant. So we may share, because sharing ideas or sharing information, it helps a lot. You may learn something new, which actually maybe you might not have got from somewhere, and you never know, it may work out for you, because it has worked out for many of our clients, and we thank God for that. So also remember, as we are ending this video, remember to put your trust in God. We can tell you what we learned, and then we can tell you this information, and then you can get all the information from the doctors, from the experts. But remember, that information is just taught. But the most important thing is that we need to put God first. God can open new doors. God can work out new things for us if at all we put our trust in Him. So put your trust in God, get the advice from the experts, and then pray about it. I believe things will work out for you, my friend. If you have been trying to get pregnant and you have been having issues, I welcome you on this channel. I'm ready to talk to you. Ask me all your questions. If you are not able to book at the website, ask your questions just below this video in the comments. I will answer all your questions. And remember, it is very, very possible you can get pregnant. Where there's a problem, there's a solution. Have yourself a fantastic and healthy day. It is actually coming to midnight here in Uganda. So I don't know what time you are watching this video, but remember, we can always catch up. If at all you have any questions, I would like to talk to you. Have yourself a fantastic day. Have yourself a fantastic night. Gerald Massa, the Health Educator, is my name. I'm from Gerald Massa, thehealtheducator.com. See you in my next video tomorrow at exactly 17 hours. Bye-bye.